In this video, I'd like to talk about one of the more common overuse injuries in Kendo, tennis elbow. Before we get started, a quick disclaimer. I'm not a doctor, and this shouldn't be construed as medical advice. This information comes from my own experience with Kendo and with tennis elbow. Also, in my day job, I'm a journalist, and I covered science and medicine for several years, so I have an abiding interest in sports medicine, both in theory and in practice. Tennis elbow is an inflammation of the tendons that attach the forearm muscles to the outer part of the elbow. There's a bony protrusion here called the lateral epicondyle, and the forearm muscles are attaching to this single point. As my sports doctor explained to me, it's a kind of evolutionary maladaptation. The elbow really isn't adapted for the kinds of stresses we sometimes put it through. There's also a condition called golfer's elbow. That's when the tendons that attach to the medial epicondyle on the inside of the elbow become inflamed. It's much less common than tennis elbow, and as the name suggests, it's often found in golfers and sometimes among swimmers, as I painfully found out when I was training for triathlons. When you have tennis elbow, you'll commonly feel soreness or pain in this area. At one point in my own case, it was so sore that I could barely pick up a mug, like this. You may also find it painful to turn a doorknob or a screwdriver. Those are all activities involving a gripping motion, as does Kendo or tennis, which have the additional stress that there's repeated impact precisely at the moment when you're required to exert a lot of gripping force, which is what tenouchi is. One device that I used as a stopgap measure is a strap, like this. It applies pressure to the forearm muscles and tendons near the elbow, and it reduces some of the stress on the lateral epicondyle. If you do use one of these straps, just make sure you find one that has a pad that will press down on the forearm muscles. Like that. And a strap like this may just help you manage the soreness a little bit, but of course it isn't a cure. I'll go through my own case history because I think it's pretty typical of the treatment. First of all is rest. If you get to a point where it becomes so painful that it interferes with your tenouchi, then you should really consider taking a break for at least 6 weeks. Rest is the first line of defense against a repetitive stress injury. Now, I know that taking time off from training can be a drag. If you enjoy training, it's the last thing you really want to do. But if you struggle through the pain and keep practicing, then an injury that might have gotten better in a month or so could become a chronic condition. So taking a break is part of the discipline of being an athlete. Next, you can try taking a non-steroidal anti-inflammatory drug, an NSAID, like ibuprofen. If you have a relatively mild case and you take an NSAID consistently, it may resolve your problem. Just make sure you don't take an NSAID on an empty stomach. It can cause gastrointestinal bleeding. This is one of the real dangers of NSAIDs. More than 100,000 people go to the emergency room every year in the US because of a serious case of gastrointestinal bleeding due to NSAIDs. Next, don't ice the injury repeatedly. This is a point that even a lot of medical professionals aren't quite up to date on. Icing may feel good at the time and reduce swelling temporarily when you have an acute injury, but we're talking about a chronic injury. And there's a growing body of evidence that suggests icing can actually be counterproductive to healing. Inflammation is the body's natural mechanism to heal an injury, and research suggests that icing can hinder that process, prolonging the time it takes to heal. Now, in many cases, it's not enough to take a break or take an NSAID, because once you return to Kendo, you may find that the problem comes back. So you need to do something to address the underlying cause of the tennis elbow, not just addressing the symptoms. In my case, I went to an orthopedic specialist, and he initially recommended a course of physical therapy. It involved some rehab exercising using weights and resistance bands. A typical exercise would be flexion and extension of the wrist while holding a weight. But as I'll explain later, this isn't ideal as a rehab exercise. When the PT didn't work for me, I returned to the doctor, and then he gave me a shot of cortisone or corticosteroids, right here. I saw an immediate improvement within a matter of a day or two, so used under the right conditions, a cortisone shot can work wonders, but it also has some side effects that you have to be cautious about. One is that cortisone will degrade fat cells, so if the shot is administered near the surface of the skin, it can produce a divot. Now that's not necessarily an issue for a spot like the elbow, where the cosmetic consequences of a divot in your skin are quite minimal, but it's still something you should take into consideration. The more important and potentially dangerous side effect is that corticosteroids can potentially weaken this tendon, making it more prone to rupture. That's why doctors recommend not getting multiple cortisone shots in one location. In my case, the single cortisone shot got me over the hump of the injury. The tennis elbow wasn't completely cured, but it took enough of the edge off the pain that it wasn't debilitating. But I still needed to do something to fix the underlying issue. And then, quite by coincidence, I came across an article in the New York Times about a small clinical study using a device that looks like a rubber baton. It's called a flex bar. According to the article, the treatment was so effective that they stopped the trial because it would have been unethical not to give the treatment to the control group. If you've read as many medical papers as I have, you'll know that kind of dramatic effect is quite rare. I'll put a link to that article in the description below. This is how the flex bar works. If the right elbow is the one that's bothering you, you grab the flex bar at the bottom with the right hand facing your body, and the left hand grabs the top facing away from your body. You grip it tightly, and then you extend both arms so that you're twisting the rubber bar. Then you'll unwind the bar by letting the resistance slowly twist your wrist into what's called flexion. This is flexion, this is extension. One of the major discoveries in physical therapy in recent years is that the most effective way to rehab a tendon is by putting it under load on the lengthening motion, also called the eccentric motion. For example, if we're talking about the biceps, then this would be the concentric motion when the muscle shortens, and this would be the eccentric motion when the muscle lengthens. So what the flex bar is doing is putting a load on the tendons that attach to your elbow primarily during the eccentric motion. The equivalent for your biceps would be doing this. No load on the concentric motion, and then putting a load on the eccentric motion. In my case, I kept the flex bar at my desk and used it a few times a day, doing about 8 to 10 reps each time. You may have to vary the number of reps depending on how sore your elbow is. Just as an aside, there's also an exercise you can do with the flex bar for golfer's elbow. In that case, you grip the bar in reverse of how you grip it for tennis elbow. The flex bar comes in various resistance levels, but I chose the green one, which is the medium resistance. I'll put a link in the description below to the Amazon page where you can find the flex bar. My tennis elbow got better within a matter of weeks using this, and I used it periodically in the following months, just as a kind of tune-up whenever I felt my elbow getting sore again. And knock on wood, I haven't had an issue with tennis elbow in a number of years now. I think the most important takeaway is to listen to your body. If you want to have longevity in any intense physical activity, you have to know when you can push through discomfort and when to take it easy. So please train smart.